7:30.
And expecting parents really need to watch this next report. A Westminster family will have to pay $5,000 more for a normal hospital birth simply because of where the parents' birthdays fall in the calendar year. CBS 4 investigator Katie Weiss breaks down the obscure birthday rule that one state official agrees needs a fresh look.
Baby Jack came into the world last August with no complications, no birth defects. He and his mom, Jessica Rapp, stayed in the hospital for only 2 nights. 3 months later, she learned those 2 nights would cost her family $5,000 out of pocket due to a state insurance law for newborns called the birthday rule.
We had never heard about it before. It was never mentioned at any prenatal appointments with my doctor or my phone calls with the insurance company beforehand.
The birthday rule says if each parent has separate insurance, the newborn must be covered under the parent whose birthday falls earlier in the calendar year.
I don't know whose job it should be to tell people about this, but I feel like it needs to be passed on somehow.
Jack's dad, Jake Irwin, says his birthday falls in January and Jessica's falls a month later in February. So Jack's birth must be covered under his father.
Completely arbitrary.
But Jake's insurance isn't as good as Jessica's, so the family is now looking at a 3-year payment plan just to pay off the birth. They've spent hours over the last few months trying to figure a way out.
From our situation, the rule only hurt us. The fact that we have 2 insurances and are almost at fault for that, we're being charged more, doesn't make sense.
The Colorado Division of Insurance says the rule started in the 70s as a way to ensure a newborn would be covered.
When it came about, it probably envisioned that the 2 parents with their employer-based insurance plans probably would have very similar plans. Obviously, we know that that's not the case.
Vincent Plymell, assistant commissioner for the division, says there's no way for expecting families to get around the rule for the initial birth, but parents can petition to change the insurance coverage for the baby within 30 days of the birth for any other future medical expenses.
If they feel that something's amiss, something's not right, to contact the Division of Insurance. Even when rules are supposed to be followed and done in this way or that, mistakes are made.
I'm told the rule is tough to change because there needs to be a default to make sure a newborn has coverage.
What's the right rule? Is it a birthday rule? Is it something else? What is it? But you have to land on something.
Jessica and Jake hope legislators will take a second look.
I truly think there should be a choice. I'm the one who had the baby, and I feel like as the mother, I should have a say in whether he is covered under my insurance plan or not. To not be able to choose something so big about my baby seems like kind of like a right that I should have, and I don't.
If you have questions or concerns about the birthday rule or would like the Division of Insurance to investigate your situation, we put their contact info for you on our website, cbsdenver.com. At the Capitol, I'm Katie Weiss, covering Colorado First.